My name's Larry Buron, and I'm a contractor, work for Apt Associates. We're the contractor to HUD, who received money from FEMA to do an evaluation of the alternative housing pilot program. And specifically, we're doing an evaluation of the quality of life changes from moving into an AHPP unit. There's another set of contractors who are doing what we call the building sciences evaluation, looking at moisture levels, stability of the housing. But we're looking at the people side. We have two sides to our study. One is a process study where we're following the implementation to see what barriers are encountered in trying to implement this program and what can be learned from the ways the states have overcome these barriers, the challenges they faced, the decisions they've made. And the other part, which I'm going to talk about today, is the survey part, where we're surveying residents, participants in the AHPP program about how it's changed their quality of life. And we had a baseline and follow-up survey, and we just did the follow-up survey in the fall of 2008. So we're going to talk about the results from that survey. It asked about, first I'll just tell you a little bit about it. It asked about a variety of quality of life domains. It asked about housing conditions, neighborhood conditions, physical and mental health, children's behavior, children's health. We picked a random sample of people who had moved into an AHPP unit in Mississippi before February of 2008, because we were doing the survey in the fall of 2008, and we wanted to make sure they had at least 6 months experience in living in the AHPP unit before we interviewed them. We had a very good response rate to the survey. It was 83%, so we completed 281 surveys out of the 340 people that we targeted to survey. So first question is, who's getting these AHPP units? It's mostly white, just like the community that it's serving. It's almost exactly the same. 77% of the participants are white, and it's almost exact same percent in the 6-county area. Same with the education level. About a fifth are high school dropouts. Most of the people are high school graduates, and about 13% are college graduates. That's the same as the distribution in the 6-county area. They're a little bit older than the overall population, a few more elderly. There's a larger percentage of single-person households. I think 36% of the recipients are single-person households. And part of that's an artifact of the program. The one-bedroom model was ready before the 2- and 3-bedroom models, and so a slightly higher proportion of the early recipients are single-person households versus the later participants. More than 1/3 of the households have at least one disabled person. That's about twice as high as the national average. The households are a little bit less likely to be working, and part of it, we think that's because of a higher percentage of them are elderly and a higher percentage are disabled. So about 50% of the respondents were working at the time of the follow-up survey, and in that 6-county area, about 59% of adults are working. So it's a little less likely. And they are mostly low to moderate income households. About 80% of them are below the median in those counties. But as Mike said, there wasn't an income requirement for this program. The requirement was that you didn't have a permanent housing as a result of the storm. So about 20% were above the median, including some people in our survey were actually, based on self-reported income, were actually quite wealthy. But most of the people who didn't have housing at this time, didn't have a viable alternative, were low or moderate income people. 66% of the households, or 2/3, were pre-Katrina homeowners. One of the features of the program was MEMA didn't provide land to put up these units. So you had to have land to put the unit on. So usually that's why there's so many homeowners in the program. And actually, the homeowners are almost exactly the same as the percentage in the 6-county area as well. 71% of the area were homeowners prior to the storm, and 66% of the people that received these units were homeowners. Almost all of them were living in a FEMA travel trailer or mobile home right before they moved into their AHPP unit, and then the other ones who weren't had lived in a FEMA travel previously and had moved to another location. Okay, so some of the things we asked about on housing quality, and you'd expect housing quality is probably the most direct effect of the HPP program because it's actually physically changing the unit that you're living in. Even though it's not that much, the one-bedroom units aren't that much bigger than in square footage terms than a travel trailer. There's a lot of features that are a lot better. You saw the roofs in the pictures that Mike had. They actually have a lot taller roofs, so it gives you a feeling of roominess. The design is nicer. There's an actual bedroom in the unit. As you know, in a travel trailer, there's kind of a little cove where you can sleep with a curtain that you pull in front of it, so there's no door you go behind. There's a full stove, 4-burner stoves in these. There's an oven. There's a bathtub and a shower. In the travel trailers, there's a 2-burner stove, and there's a little shower, but there's no bathtub. So there's a lot of features that make it feel more like at home. And you can see some of the quotes on the right-hand side. A lot of the things that people appreciated about it was being able to move back to do some of their normal activities. You know, some of the things we heard were like, I can invite company over, I can play my card game, I can have someone over for a meal, I can have my family over, we can all eat a meal at the same time. So a lot of really basic normalcy things were what they seemed to appreciate. We asked them to compare the quality of the unit in the baseline survey and in the follow-up survey, and then we asked them to directly compare it in the follow-up survey. 90% reported, that the HPP unit was higher quality. Nobody reported it was worse quality. The other 10% said it doesn't make a difference. It's not my home. It's the same. We asked about a lot of different problems that they might have with the units. We asked about mold and mildew, electrical, plumbing, toilets, floors, and exteriors. And on every single item that we asked about, they'd had fewer problems in their HPP unit, again, pointing to it was built a little higher housing quality. Some of the more extreme ones changes were before in the travel trailer, 38% said they had big problem with a broken lock on their door or their windows, exterior windows. And that was only 4% for the people in the HPP units. Big decrease in bad odors, a big decrease in electrical problems. It's not shown up there, but that also went. In the travel trailers, 37% said they had gone without electricity for several hours because of electrical problems. And in the FEMA units, that was negligible. It was down to Well, it wasn't negligible. It was down to about 11%. So it had gone from 37% down to 11%. And one of the things we were concerned about is some of the people had lived when we did this survey, people had lived in the FEMA, in the travel, they'd lived in the HPP unit from between 8 months and about 18 months. And some of the people who lived in the travel trailer had lived there for over 2 years. But we did comparisons where we held constant how long they had lived in their units, and it still was much smaller reports of problems amongst that travel HPP unit people. So it's nothing to do with how long they've lived there. It has to do with the quality of the unit. Okay, one of the big complaints you hear about the travel trailers is every time the wind blows, it kind of shakes a little bit. People talked about when a truck drives by, the unit shook. So one of the things they really liked about the HPP unit was it felt much more stable. Felt like a real home. And the tie-downs that they used, even for the temporary housing, even though it was a temporary installation, were to withstand winds of 150 miles per hour. So when you talked about Hurricane Gustav hitting, there wasn't damage from the winds. There was damage from the water because they weren't elevated. They actually held up really well from the wind. There was no, as far as I know, there's only negligible kind of some siding problems with a few units, but there was really no wind damage from Gustav. And people were very, I think that really, we were a little bit scared because we were doing this survey about a month after Hurricane Gustav. So we thought, that's going to bring back a lot of issues with the previous Hurricane Katrina, and they're going to see some of the weaknesses in these units now that they've kind of lived through a more minor hurricane in the case of the Gulf Coast of Mississippi. But we thought this would be a real problem. There'd be a lot more complaints. But actually, it seemed to reinforce their belief that these were stronger units rather than making them feel skittish about the units. It actually reinforced their perception before the storm that it was stronger. Okay, we asked about physical and mental health. The reasons you might expect a new housing unit, the HPP unit, to have an effect on mental or physical health, there's a couple reasons. One is it might be less stressful to know this is where I'm going to living. This is where I'll be living for at least the next 2 years. It feels more like a home, so it has these features we talked about. It has more privacy. It has higher ceilings. It has a little porch on the front, so it feels more like a home. So you would think, and it's less stressful. They're a little bit bigger, so there's also a little bit less crowding. So there's a bunch of reasons that you'd expect people to have less stress in their life, which might lead to physical or mental health improvements. There's also this travel trailer issue possibly with formaldehyde. So we asked about respiratory problems and how those have changed. And interestingly, a very strong result of the adults who'd reported respiratory problems prior to moving into the HPP unit, 1/3 of the adults reported they had improvements in their respiratory problems after moving in. Now, we can't conclusively say that's because of the HPP unit, because it could be maybe they're getting to see a doctor now more and getting some dealing with the health problems. But it seems like there's definitely a correlation with improved a decline in respiratory problems. Of the other people who didn't report improvements, about 50% said there was no change. Almost no, actually, it's like everybody else except for 5% reported there was no change. About 5% said that their respiratory problems had gotten worse since they moved into their AHPP unit. So 1/3 better, 75% about the same, or 65% about the same, and about 5% said worse. And these are also backed up, both these physical and the mental health, where we also asked people, we interviewed some people more in depth, and we also asked people on the survey of 281 people, we asked them at the very last question was, how has the HPP affected the quality of your life? And just let them say whatever they wanted. And it was amazing the number of responses that had something to do with, I feel more normal again, or I feel there's less stressful, there's more space, I have more privacy, so I feel more sane. So a lot of these open-ended answers were all based around kind of a sense of relief and a sense of I feel more normal. I feel like my more normal life is back again. And so even though we can't you can't say that the HPP unit, we don't have the quantitative evidence that it's totally because of the HPP unit, there is also some backup on what they said qualitatively about why it might have affected their health and improved their health. Okay, we asked a bunch of questions that's used on like the National Institute of Mental Health surveys on mental health about how much of the time do you feel hopeless, how much of the time do you feel cheery, how much of the time do you feel sad, and these questions, all of them showed improvement after moving into the HPP unit. One of the biggest ones was prior to moving into the HPP unit, when they lived in the travel trailer, about 30% of the people said they didn't feel hopeless any of the time in the previous month. After they moved into the HPP unit and we interviewed them, 60% they didn't feel hopeless any part of the month. So there's still some issues with mental health, but it's both because of time and the recovery time from the storm and after moving into a more stable unit, there seems to be reductions in mental health issues. Post-traumatic stress disorder, we don't have a baseline on this, so we don't have a comparison of before and after. But about 17% in the fall of 2008 still met the PTSD symptoms, had enough symptoms on the questions we asked that they would be qualified as PTSD. There were other surveys done by other researchers post-Katrina that were done about a year before our survey, and they showed about 25 to 30% of the people had PTSD. So it's not a perfect comparison group because it is a year earlier, a year closer to the storm. But ours is lower than that. The Kessler Harvard medical study has found. His studies also included all 4 Gulf states. This one only was interviewing Mississippi people. Well, that's my last slide. Thank you.